So we were talking about pneumonia, we talked about community-acquired pneumonia, we talked about aspirational pneumonia, and let's get to the next case here. So Mr. Lang is a 70-year-old male with a past medical history of hypertension, hyperlipidemia, and coronary artery disease. He was in the hospital just last month due to a GI bleed in which he stayed in the hospital for 5 days. Today he comes in with cough, shortness of breath, and fever. What are you thinking about? Pneumonia. Chest x-ray is positive for infiltrate. Again, they could either read it as an infiltrate or consolidation. Or sometimes they just call it as a pneumonia, but they could read it that way too. They are causing for admission. What are your thoughts? How would you treat this? So the question here is that, do you think this is a community-acquired pneumonia? No. So this patient was just here last month. He was admitted in the hospital for 5 days. The point here is that this patient has been exposed to the other bacteria like MRSA and Pseudomonas. So the new guidelines tell you if you have an increased risk of having MRSA and Pseudomonas, you have to cover them. So this patient was just in the hospital last month. He has been exposed to other sick patients, sitting in the hospital bed, being exposed to nurses and other sick patients around him in the emergency room and upstairs. So this is what we call healthcare acquired pneumonia. This scenario could be one of them. The second scenario that could happen also is that patients can start having this kind of pneumonia while they are in the hospital. So they're in the hospital and they start having a pneumonia. Again, this is another healthcare acquired pneumonia. Patients who are on a ventilator, they're intubated. These patients can also have pneumonia.